Welcome to our first episode on Alzheimer's disease. Today we talk about a disease that affects the mind, that affects the memory process. So in this section, episode 1, we'll discuss Alzheimer's disease, how a person with the condition becomes noticed, what are the risk factors associated with this type of condition, the various types of memories, the biology of memory loss, the warning signs, and the question Phillip Academy is asking is, can we halt the decline in this disease process? So we'll discuss the role of 5 memory enhancers and how they work. Phillip Academy's efforts would be focused on aiming to slow down the process of the disease where possible, even reversing the disease with simple but effective strategies. We'll discuss the factors which contribute to Alzheimer's disease. We will suggest how best we can protect ourselves from this condition. We'll discuss the impact of this disease on our lifespan and the histological findings in the brains of people who are so affected and who have come to their demise based on the disease. And we'll also discuss the value of neurotransmitters in the memory process. The brain. We consider the brain to be the template which needs to be treated right. It is essentially a soft, mushy structure which is housed or protected in a hard, bony box called the skull. One major indication of the dysfunction of the brain, as evidenced in the children's discussion, is the failing of memory. We come now to the types of memory. Back in school days, we learned about memory being of 2 types, short-term memory and long-term memory. This morning, we introduced to you 4 types of memory. We talk about sensory memory, short-term memory, working memory, and long-term memory. The memory affected by Alzheimer's depends on the stage of the disease. So at different stages, we may find different aspects of our memory being affected. The information from the world around us is stored as a sensory memory. Now we have 5 different senses. So we have 5 different elements of sensory memory. Memory relates to hearing, to tasting, to sound, and to touch, and such alike. So each of those components would be related to sensory. But sensory memory tends to be fleeting unless you pay attention to it. For example, you may hear sound and you might figure, it doesn't interest you. So sensory memory tends to be fleeting unless you pay attention to it. It is also referred to as a sensory register. It is the information which we receive from our senses, like seeing an item, feeling an object, smelling a sense. Since we have 5 senses, we have 5 different types of sensory memories. Short-term memory, on the other hand, describes the ability to retain small amounts of information in an active, readily available state for a short period of time after receiving it, about 30 seconds. Hence, people with short-term memory loss have problems recalling information which they have just received. This must be distinguished from the inability to recall information because of lack of interest. Individuals may be talking to you about something, and because you're not interested, you just don't recall what they were saying. That is not the same as short-term memory loss. It's a question of your lack of interest in whatever was discussed or was mentioned or spoken about to you. So one can further describe short-term memory as a short-lived storage facility which can only hold a few pieces of information. Short-term memory creates a kind of visuospatial sketch of information that the brain has recently absorbed and will process into memories later. Memory is but a tiny part of brain functioning. Types of short-term memory. We have at least 3 different types of short-term memory. We talk about iconic short-term memory, which relates to the ability to store images. This type of memory is very short-term sensory memory in which a person can recall visual images just for a few milliseconds after the physical image has disappeared. They last no longer than 500 milliseconds. Acoustic short-term memory is the ability to store songs. It involves a type of coding in which you can remember and comprehend something that you hear. Working memory relates to the ability to store information till it is used. It relates to the ability to use, manipulate, and apply memory for a short period of time. So the operative measure here is the duration during which you can have access to that memory. So when you have access to bits of information for a short period of time, we categorize that as short-term memory. This, of course, must be distinguished from a bit of information that was shared with you, but you had no interest in, so you quickly forgot. This is not short-term memory loss. It's different from that. Okay? Now we talk about long-term memory. Long-term memory takes the information from short-term memory and converts it into long-lasting memories. So for you to have long-term memory in exercise, you must have it acquired from short-term memory. So short-term memory comes, it introduces something to you. If it's something you're interested in, then your long-term memory takes over and stores it for long-term use. Long-term memory may be subdivided into procedural. It is a type of long-term memory involved in the performance of different actions and skills. So if you talk about long-term memory, the procedural type, like learning to drive, after you are taught and you learn how to drive, you don't have to try to remember how to drive. It's just something that is there. It's part of your long-term memory. Then we talk about semantic long-term memory. This is a conscious long-term memory of meaning, understanding, and conceptual facts about the world. It is one of two main varieties of explicit memory. Conscious long-term memory, which is a memory that can be retrieved into conscious awareness after a long delay, from seconds to a few years. So you may find that information that you're exposed to, even at school days, you may still be able to recapture the information after several years. That is an exercise of semantic long-term memory. Then we talk about episodic long-term memory. It's the ability to recall and mentally re-experience specific episodes from one's personal past, which is distinct from semantic memory that includes memory after generating context-free knowledge. Episodic memory relates to memory in context of time, place, and associated emotions. Example, where your car was parked. So if you parked your car in a car park at location A, and you find that you cannot remember exactly where your car is parked, that would be an evidence of episodic memory failing you. Okay? Because it is a sort of memory that you experience based on a past episode, which is distinct from, the other types of memory. We talk about semantic memory, which in episodic memory talk about memory in relation to a time, place, and the context in which it happened, which is very different from any emotional state or any long-term memory as a result of just mere interest in a short-term event. Long-term memory takes information from short-term memory and converts it into long-lasting memories. So for you to have long-term memory, you need to be exposed to short-term events, which first enters your short-term memory, and then your long-term memory takes that information and converts it into evidence that you can rely on, or information that you can rely on to do subsequent activities. But long-term memory in itself is divided into at least 3 different compartments. We talk about long-term memory has been divided into procedural memory. Talk about it divided into semantic and episodic memories. Procedural memory is a type of long-term memory involved in the performance of different actions and skills. Essentially, it is the memory of how things are done. And simple reflection on this type of procedural memory, think about learning to drive a car or learning to swim, for example. If you learn to do any of those activities, you don't have to try to remember how it is done. You get in and it's like, it just happens, like almost like clockwork, You know how to drive, you just go ahead and drive. You don't have to think, oh, do I do this now? Do I do that now? It just happens. That is the exercise of long-term procedural memory. Then we talk about semantic long-term memory. This is a conscious long-term memory for meaning, understanding, and conceptual facts. So if somebody says something to you, for example, tells you, in a storm, we have high winds, we have rains. You haven't got to try to remember that. It just happens that if they tell you a storm is coming, you expect high winds, you expect rain. So that's a type of conceptual type of memory in action. It is one of two main varieties of long-term memories: explicit and conscious long-term memory, which is memory that can be retrieved into conscious awareness after a long delay. How long is that long delay? It could be a few seconds to several years. Episodic long-term memory is the ability to recall and mentally re-experience specific episodes from one's personal past, which is distinct from semantic memory that includes memory for generic contexts, say free knowledge. Episodic memory relates to memory in context of time, place, and associated emotions. Example, where your car was parked. Memory is but a tiny part of brain functioning, but a large part of a person's identity. So we continue talking about long-term memory. Long-term memory is not a single store, but it has two components: a declarative or explicit component and a non-declarative or implicit component. Implicit memory or non-declarative memory includes procedural memory and things learned through conditioning. Okay? So you have got to, declare what you're doing. It's just implied, just going through the motions. It's like driving, as you said earlier. That's a type of implicit long-term memory. In declarative memory, though, there is a storage of facts and events we have personally experienced. So if somebody slapped you, or your teacher at school said something to you which made you feel uncomfortable, that would be a type of declarative memory. Whenever you think of saying something, like you said, when the teacher scolded you, will come back to your memory, and as such would prevent you from behaving that way. Okay, so that's a type of declarative long-term memory. Now, unfortunately, this is a type of memory which is impacted early in Alzheimer's disease. So we talk now about Alzheimer's disease and episodic memory. Controlled episodic retrieval of information is impaired in Alzheimer's disease, probably because brain regions of a core episodic network are disconnected. So we say that in Alzheimer, episodic memory is affected early, and it's probably because of connections between neurons have been disconnected or have been broken. All types of memory, episodic memory, semantic memory, procedural memory, are all impaired at some stage of Alzheimer's disease. Most complaints, however, concern recent episodic events. Okay, so we talk about long-term memory as being affected by Alzheimer, but it's based on the stage of Alzheimer's at which the particular person is. Recollection of recent information can be distinguished in two functions: a retrieval of information associated with time, place, circumstances, emotions, and personal thoughts, and two, familiarity. Familiarity, on the other hand, is a mere feeling of knowing the information without access to the context of encoding. Recollection is impaired in Alzheimer's disease. The status of familiarity is debatable. So whereas in Alzheimer, it may be difficult to recollect information, remember information, but we have to try to distinguish that from familiarity. Because if you know somebody, you happen to just know them. You haven't got to try to remember anything about them. But if somebody says something to you, you may, in fact, your address, for example, your home address, you may find it difficult to remember different aspects of your home address, your postcode, your house number, and stuff like that. But that varies depending on the stage or the stage of Alzheimer at which you are. So we spoke about Alzheimer. We talk about how it affects our mental health, or it affects our memory. The question is, how do we, or can we, maintain our general brain health? Are there any things we can do? After all, that's the intention of Phillip Academy, to try to minimize the impact of various disease conditions on your person. In other words, try to help you to reclaim your health. So one of the things we would suggest from the academic standpoint is we need to try to encourage blood flow to our brains. How do we do that? We engage in heart pumping activities. So joining the gym, working out on the whatever machine you choose to use there will help to increase your heart rate and increase the blood supply to your brain. As a result, it would therefore help to reduce your risk. It wouldn't prevent it, but it will help to reduce your incidence and probably slow it from developing. Now, we also have other medical conditions which we will discuss in the next series of podcasts. Medical conditions that affect your vascular system. Things like diabetes, hypertension, cardiovascular disease. Those factors will reduce the amount of blood supply to your brain and as such predispose you to an increased risk of developing brain issues and memory problems as seen in Alzheimer's. Most of us tend to boast how we get by on a few hours of sleep, 1 or 2 hours of sleep a night. That's not good. That's not wise. Actually, would suggest a minimum of 7 to 8 hours of sleep per night. It's very important that we do that, and we'll understand as we go on in this presentation. Now, there are certain drugs that cause us to feel zombie-like, We have to be careful. We are treated with a few drugs that cause anxiety, that are related to try to suppress anxiety episodes. Those drugs tend to calm us down to the point where we just drift. All right? For example, drugs like lithium, for example, you'd see people behave very mechanically as opposed to a human flow. So we have to be watchful for some of the drugs we're exposed to, because those drugs could give some degree of contribution and make us seem as though we are suffering from Alzheimer, although it may just be the effect of the drug. We must keep our brain active by learning new information. You'll realize as we go further that one of the problems with Alzheimer is our inability to use our brain intelligently. So if we can practice using our brain just to do some little tasks, simple tasks, crossword puzzles, playing games which require some thought process, that may help to maintain our brain health. So that's one. So those are suggestions we would make from the academic standpoint. That's things you could do to help to maintain your brain health. Now, we talk about brain health, we talk about nerves, we talk about neurons and so on. But nerves, although they may be in communication with each other, it would seem to us that there needs to be some mechanism by which a signal is transferred from one neuron to another neuron. We have found that there's a particular compound called acetylcholine, which plays a major role in the memory process and brain activity. Its presence is in adequate quantities, strengthens neuronal connections, and helps to maintain a sharp memory. Focus on increasing levels of acetylcholine in the brain by increasing the levels of raw material which is necessary to produce acetylcholine will improve our memory. So just by increasing our acetylcholine in our brain, which is a neurotransmitter, it helps to improve our memory. So we can maintain the levels of acetylcholine in our brain in two ways. Either providing it with raw materials to synthesize acetylcholine, or else reducing the rate at which acetylcholine is broken down by different enzymes. Because at the end of the day, we want to ensure that we remain as sharp as we possibly can. And we think that acetylcholine is one such substance that can enhance that procedure. Unfortunately, as we get older, our levels of acetylcholine declines. And this is one plausible reason for our memory difficulties that we experience as we get older. In patients with Alzheimer's disease, there's an obvious deficiency of this important neurotransmitter. So there again, we're talking about acetylcholine as being a very potent neurotransmitter which is useful for our memory and our sharpness to be maintained. Reducing acetylcholine deficiency is an important step in the treatment of Alzheimer's disease. So if we understand that acetylcholine is important to keep us focused, sharp, and our memories up to on par, then it's important to understand that if we can increase our levels of acetylcholine through whatever means, whether it be decreasing the rate of breakdown of acetylcholine or giving a person substances which can encourage your body to produce more acetylcholine, that would help to delay or to put off the onset of Alzheimer's. As one gets older, his or her levels of the neurotransmitter acetylcholine declines. And this is one plausible reason for the memory difficulties that we experience with individuals as they get older. In patients with Alzheimer's disease, there's an obvious deficiency of this important neurotransmitter. Reducing acetylcholine deficiency is an important step in the treatment of Alzheimer's disease. So apart from what we said earlier with regards to increasing blood flow through the brain and so on, we understand now that if we can keep acetylcholine in the vicinity of our neurons for a longer period of time, we can actually help to stave off the onset of Alzheimer's. So increasing levels of acetylcholine creates a new neural, Increasing levels of acetylcholine creates new neural connections which enhances the information sharing network of our mind. It restores retentive memory, clears focus, and encourages confident decision making. So as we can see from that, acetylcholine is a very useful friend of our memory. If we want to maintain our memory, acetylcholine maintenance is the way to go. Either we increase it by giving our bodies the raw materials it needs to produce acetylcholine, or we delay its breakdown. Now I'll give you some ideas of some acetylcholine precursors. We talk about phosphatidylcholine or lecithin, and alpha-glyceryl I'll just stop at phosphatidylcholine or lecithin to make it simple. All right. So we talk about phosphatidylcholine or lecithin as a necessary precursor which can be converted into acetylcholine and can easily cross the blood-brain barrier. As we indicated earlier, the use of acetylcholine in helping to maintain our memories and keeping us sharp and focused is integral to staving off Alzheimer's disease. So we're going to mention a few precursors that can be useful in that venture. Among them is phosphatidylcholine or lecithin, which is able to cross the blood-brain barrier without any difficulty. And once in the brain, it combines with acetyl coenzyme A to form acetylcholine, which again is the purpose of trying to stave off Alzheimer's. Lecithin is primarily found in soya beans and eggs. So it's one thing telling you about lecithin or phosphatidylcholine and not telling you where you can get it from. We're saying to you it can be found in soya beans as well as in eggs. It is also present in wheat germs, peanuts, and liver. In the diet, lecithin is the main source of choline. So when you talk about, hey, how am I going to get some choline? Lecithin is the way to go. In the diet, lecithin is a major source or the main source of choline. In the brain, lecithin combines with acetyl-CoA, that's acetyl coenzyme A, to produce acetylcholine and thus increases the levels of acetylcholine in the brain. Now we spoke about Alzheimer, what it is. We talk about the various types of memories. We talk about the importance of acetylcholine to try to keep us sharp and to maintain our memory. We talk about how we can get the precursors for acetylcholine into our bodies. We talk about diet. We talk about lecithin as an important precursor to the formation of acetylcholine. Now we talk about how can we define Alzheimer's. We look at the stages of memory decline. Stage 1, we talk about senior moments. You might see an elderly person and he or she has difficulty remembering things and say, well, hey, he has Alzheimer's. No, it's not necessarily Alzheimer's. There is a natural loss in memory related to aging. And it is being assumed to be because of the diminished amount of acetylcholine in our brains. So senior moments does not equal to Alzheimer. If you remember the conversation from the children earlier, when one said, well, anytime I forget something, does that mean that I have Alzheimer's? The other child could say, obviously, no, it's not that. So we're saying the same thing here. Forgetting something, even in advanced years, doesn't necessarily mean you have Alzheimer. It may be a warning sign that you're coming down with Alzheimer, but it is not equal to Alzheimer's. We also talk about the second stage, which is brain fog, which is difficulty learning new concepts. You remember that we said that one of the things we can do to stave off Alzheimer is engaging in activities that helps us to think or to use our brain, to crossword puzzles, playing games which require our thought process and so on. Those things will help to stave off the onset of Alzheimer's. Now, as Alzheimer's becomes more and more advanced, there's a tendency to withdraw from social activities because your memory, your difficulty in recalling events becomes more and more obvious to people around you. You begin to feel uncomfortable thinking that people are judging you because you can't recall certain things, and you might feel uncomfortable in such social settings. So such a tendency is to withdraw, because you may not be able to remember simple things as names, dates, everyday facts may just slip your mind, and as such you figure, well, why do I have to struggle, and these people are laughing at me, even if they're not visually laughing at you, but that's how you may feel. So you tend to move away from public meetings or social gatherings because of that purpose. Now, we see the impact of Alzheimer's. We see what we can do to help to stave off Alzheimer. Now we look at some memory enhancers, something that can help to keep our memory focused and keep us sharp. We look at alpha GPC, that's alpha glyceryl phosphorylcholine. It's found in some food supplements and produced in the body. It transports choline efficiently across the blood-brain barrier and serves as a precursor to acetylcholine. The blood-brain barrier is not a fence or a hedge. It is essentially a protective area of cells that prevents most substances from reaching the brain to protect it from pathogens and toxins. Some compounds can move through this filter to reach and affect brain cells easily. Others are blocked out. It is believed that taking alpha GPC may increase levels of neurotransmitter acetylcholine in the brain. Alpha GPC may boost cognitive function and mental performance. So if you take alpha GPC as a memory enhancer, you will find that you can remember things better and you can be more active in performing mental tasks. Some animal studies suggest that alpha GPC may improve symptoms related to Alzheimer's. So there we go. It was found to reduce the death of neurons and support the blood-brain barrier. So that's what alpha GPC was found to do. Reduce the number of neurons dying, because that's what happens with Alzheimer's, and also support the blood-brain barrier. Another such memory enhancer would be huperzine A. Reportedly, it enhances memory by suppressing the action of the enzyme that breaks down acetylcholine. Remember earlier we alluded to that. We need to keep the acetylcholine around longer. And the longer it stays, the more pronounced an effect it would have. So huperzine A does exactly that. This causes an ideal environment to form new neuron connections and improve memory retention. The side effects associated with huperzine A would be mainly related to your gastrointestinal system: nausea, diarrhea, vomiting. And there's a few related to your cardiovascular system, mainly sweating, blurred vision, slurred speech, restlessness, loss of appetite, contraction and twitching of muscle fibers, cramping and increased salivation and urine production. The inability to control your urination can be one of the side effects which might be uncomfortable for individuals wanting to use huperzine A. It may also increase your blood pressure and slow down your heart rate. So look at those side effects. If it's something if they're not enticing to you, avoid huperzine A. But if it's something that you can try and it makes you feel better, it helps your memory, but you are not comfortable with side effects, stay away. If you use it and you find the side effects are tolerable, then by all means it has its benefits. So it's up to you. You make a decision as to what is best for you. Those sorts of risk-benefit analysis on yourself. Huperzine A can remain in the body for quite some time. It has a half-life of 10 to 14 hours. So think about that. It will stay around a long time in your circulation. So if it's having a positive effect, you will benefit from that positive effect for a longer period of time. But if it has unpleasant side effects, it will be bothersome for a long time also. So again, a risk-benefit analysis would be helpful in that regard. We also talk about Bacopa monnieri. This is known as Brahmi. It's a herb used for its memory-enhancing properties. It inhibits breakdown of acetylcholine esterase. That's the enzyme that breaks down acetylcholine. Again, the effect is to keep acetylcholine around a longer time. The main indication for using Bacopa monnieri are memory improvements. It also helps if you are having difficulty falling asleep and if you suffer from epilepsy. And also if you have any anxiety-related conditions, it can help in its treatment. But however, there is a warning to be had. It should not be used by pregnant women or people with stomach ulcers or thyroid disease. If you have any intestinal problems, we'll say to you, don't use it also. It can lead to urinary obstruction and slow your heart rate, as well as increase the risk of lung disease. The side effects are mostly gastrointestinal, like increased stool frequency, not diarrhea, just having to visit the loo a little more frequently. Nausea and abdominal cramps are also known side effects of Bacopa monnieri. We talk about lion's mane as another memory enhancer. This is a medicinal mushroom that increases levels of acetylcholine by enhancing the activity of acetylcholine transferase. So like we said, we increase our levels of acetylcholine in one of two ways: reduce the rate at which it's being destroyed, or increase the raw materials available for its formation. Lion's mane seems to increase the ability to produce new molecules of acetylcholine, and hence increase the amount of acetylcholine available to us. Research suggests that lion mane can reduce anxiety. It helps prevent oxidation of cholesterol in the bloodstream. It decreases the amount of inflammation released by fatty tissue. It reduces tissue inflammation and prevents tissue damage in areas of the intestine. So lion mane is not only helpful in terms of its effect on our memories, it also has some beneficial effects on our cardiovascular system. For example, its role in cholesterol is something that's commendable. It's generally well tolerated, but occasionally it's associated with abdominal discomfort, nausea, and skin rash. It may also interfere with blood clotting medications such as warfarin and diabetes treatment. So if you're on any of those medications, the gentle advice is to talk to your doctor about your interest in using lion's mane and its benefits to you. But let him also know that you're aware that it can affect the impact of your blood thinning medications like warfarin, and if you're on any diabetes treatment, can also have an adverse effect on the outcomes of those medications. For example, in warfarin, it helps to make the blood thinner, so it makes the effect of warfarin a little more pronounced. And in diabetes medication, it can drop your blood sugar. So if you're on a regular diabetes medication, keeping your blood sugar within a certain range, with this medication, it can drop it even further. So the advice is, if you want to take lion mane as a treatment to help your mental faculties, talk to your GP first. Then finally, I'm pretty sure most people have heard about this neurotransmitter, which is helpful, ginkgo biloba. Ginkgo biloba works as a neurotransmitter enhancer. How does it do that? It increases the uptake of acetylcholine in a part of your brain called the hippocampus. When paired with Bacopa monnieri, it brings about noticeable improvement in your memory. The ingredients in most boosters can provide improvement in your memory within 30 days. And after 3 months of daily use, they significantly increase your memory improvement and may cause them to be long-lasting. So if we're on a memory enhancer, after a month, you should be able to see some noticeable improvement in your functionalities. After 3 months of daily use, these improvements would lean towards being permanent. So your memory would be improved to a point noticeably after 30 days of use. But after 3 months, that memory will almost be commonplace. That memory improvement will almost be commonplace. It would stay with you. Okay? So those of us who are suffering from Alzheimer's disease, one suggested approach is to use a neuro enhancer. All right? Now, the side effects of ginkgo biloba include stomach upset, headache, dizziness, allergic skin reactions. Ginkgo's leaf extracts might increase the risk of bruising and bleeding or cause abnormal heart rhythm. So although it is widely known that ginkgo biloba, one has to be aware of the side effects that it can bring about. They are mainly GI symptoms, stomach upset, headaches, dizziness, and allergic skin reactions, but they may also cause some bruising and bleeding or cause abnormal heart rhythm. So in keeping with the early advice with regards to the use of these medications when we are on blood thinning agents like warfarin, we should try to discuss them with our GP or doctor before we embark on the use of those neuro enhancers or memory enhancers. This brings us to the end of episode 1 of Alzheimer. In this section, we discuss types of memories, stages of Alzheimer's disease, how we can mentally remain sharp and focused. We looked at the role of acetylcholine in keeping us sharp and focused. We reviewed sources of acetylcholine precursors. We talk about lecithin, which is easily available to us because it easily crosses the blood-brain barrier and forms acetylcholine on combining with acetyl-CoA. And we also discuss memory enhancers and how they work. I thank you.